it's become acceptable to talk about are depression and anxiety, because those are now become acceptable mental health disorders because we've all been impacted, particularly during the pandemic. But it's not okay to talk about your bipolar disorder or schizophrenia in a public fashion. People are still really silent on those issues. Those are still very stigmatized. A lot of it is because there's not enough education around it. The more and more education we can do on what these diseases are, what's the chemical imbalance in the brain, what's the nature of the disease, to help people understand there is treatment available. There's lots of great treatment available.
Melissa and I, we are now live with another Meeting of the Minds by What About Health. This week, we're really eager to get into a subject that's actually really deeply impactful to access to care. We're focusing in on medical-related stigma and mental health-related stigma with Melissa Force Shackelford. Melissa has had a ton of different roles in marketing and DEI within healthcare, including a very large stint with Hazelden Betty Ford, currently with Cigna Health Services Evernorth, as well as has worked with Optum before as well. But Melissa, before we dig into our conversation, just wanted to allow you the opportunity to introduce yourself, maybe brag a little bit, and just share with everybody who you are and a little bit about your background.
Yeah, thank you so much for having me, Chris. I've been lucky enough to be a healthcare marketing leader for, well, let's say 17 years, nearly 20 years. And I've had the great opportunity to work for a lot of really progressive healthcare organizations like Optum, like Hazelden and Betty Ford. And most recently, I was at Evernorth Health Services, part of Cigna. And all of them are very progressive on how they look at behavioral health. And so I've really been I'm full of gratitude for working for those organizations, as well as being on a number of boards for healthcare organizations like the American Lung Association and others. So I think we have a lot to talk about today about how stigma impacts not just behavioral health, but all of healthcare, and how it prevents people over and over from getting the life-saving care that they need.
Could you talk about what, just share a bit about your background and context of what's led you to addressing this issue so strongly and taking the time with us to talk about stigma?
At Hazelden and Betty Ford, what we really saw was our number one competitor was do nothing, because you'd see families struggling, but oftentimes because of stigma, the individuals that were really needing that care would not get the care they needed. And so that's for me where I really started to see that we needed to break down that stigma to help these folks, help their families get the care they need. And at Evernorth Behavioral Health, I was very lucky to work with a couple of folks that were very progressive. And one is Melissa Riley, one is Bridget Myers. They're both really, I think, on the cutting edge of talking about why behavioral health isn't off to the side. Behavioral health is healthcare, and behavioral health is impacting all of healthcare spend. And so when we start to look at behavioral health as part of healthcare, we start to see that it's something that we all need to address every day in healthcare. From a personal perspective, I will say that both myself and my family has been impacted by a number of stigmatized conditions, including mental health and substance use disorder. And so from a personal standpoint, I really appreciate it when people are open about it and want to talk about these conditions in a public forum like this, so that everyone understands these are not something that we have to be whispering about off in the corner. These are something that everybody is impacted by every day across the country.
It's really painful to think about the idea that even if things like cost and access, affordability, and things like that were solved, which, I mean, that's a really big if, right? But even if we cross that chasm, that stigma would still remain a massive barrier to people's access and drive to receive services that they need.
Yeah, there's actually a publication that Melissa Riley from Evernorth Behavioral Health Services talks about quite a bit, that says 22% of people are impacted by behavioral health conditions, but their costs make up 41% of total healthcare spend. It's a massive impact when you think about it from just overall healthcare, when you think about the workers that are impacted, that missing work, taking care of a family member that has some type of condition like this, or yourself. there's a lot of lost wages there. I think NAMI puts the figure at I have it down here somewhere, $200 billion a year is what NAMI cites as the total impacted and lost wages. I mean, it's really, from a dollar standpoint, it's massive.
So that is incredible. Just knowing that there's a massive segment that, from that dollar standpoint, in terms of lost wages. And I would think also, are there additional studies that you're thinking about in terms of comorbid issues and downstream healthcare costs as well?
I think there's some well-known stats. NAMI puts it out, other people do too, that almost half of people with mental health conditions don't get care. And that's one is, for me, that comes down to, like I said before, the number one competitor we had at Hazel and Betty Ford was really do nothing, because these people weren't getting care. For substance use disorders, some of the figures that are put out by SAMHSA are that 10% of the country have a substance use disorder or impacted by that, and only 10% of those people who need the care are getting the care. That means 90% of the people who need care are not getting care.
So I'm curious about a time when you've seen institutional stigma happening, and what the situation was, and what you might have been able to do to address it.
I'd love to use some of the substance use disorder work we did at Hazen and Betty Ford. And I will say one of the first, because one of the first people to really break down stigma in that respect was Betty Ford. So Betty Ford didn't need to be public about her substance use disorder treatment, but she made the decision to release that information to the press. And here we are. So she was really one of the first people to ever talk about that. Before that, she was actually one of the first people to talk about breast cancer publicly too. So she was actually a pioneer in that respect. But I think, for one of the things that we see at from an institutional level, not just at a healthcare organization, but at other organizations, what we see is we have people who are employees, and then we have the patients that they're dealing with. The people that are employees are often suffering in silence for their mental health or substance use conditions, or their loved ones' conditions. And so part of that, in fact, NAMI does a great job. NAMI has a stigma-free company initiative that they're working on, trying to get organizations to do a couple of things. And one is to model appropriate behavior from a manager perspective. We have so many conversations around DEI and how managers can model appropriate behavior around inclusivity. But we can also do that around mental health behaviors. And so that's something that, it shouldn't just be taking PTO when you have a cold or you're sick. It's taking PTO when you need a mental health day, and modeling that behavior, making sure that your employees know that they've got EAP services if they have those. And so those are things that not just a healthcare organization, but all organizations can do to make sure that their employees are aware. A couple other things that you can do from a healthcare perspective, and this is something that I've seen both at Optum, at Hazelden Betty Ford, and of course at Evernorth Health Services in the behavioral health space, is how do we educate our healthcare organizations around how to break down the stigma, really educating them on the fact that these are diseases. And I actually been reading lately about obesity. It is a disease, and the fact that obesity, there's a lot of kind of, it's analogous in many ways to mental health, and the fact that people think it's a moral failing. They think moral failing and substance use disorder, it's a moral failing, it's not a disease. Well, it is. So is obesity. It's a disease. It's not a moral failing. So how do we educate healthcare professionals so they understand? One example I use is a friend and former colleague told a story when she had some minor surgery. Her doctor prescribed her opioids, and she asked him, why didn't you ask me if I have a problem with addiction? And he said, well, I don't ask because addicts lie. And it's horrifying to me. We have an opioid epidemic in this country, and the doctor said that, which is something that obviously he needed some more education. So my friend and former colleague was able to educate this physician and say, well, you have to at least ask the question. You never know. Let's give you more information here so that you're not just thinking that it's something that people are going to lie about. You need to have that conversation so that you don't continue to perpetuate this opioid epidemic, and educating professionals in the field so that they understand this is a disease. There is life-saving care available, and we need to break down those barriers. So there's a lot we can do, but I think we have the link to the NAMI Stigma Free Company Initiative, which I think is just a great, and it's a good resource for folks who are looking for documentation to help make a difference at their organizations.
Hearing that this physician who uh, in this conversation use the term addict to describe somebody as say addicts lie, like express some bias and all of that at the same time, that does sound like a really harrowing, like a really heart-wrenching experience for someone to have in that moment of need. And I can only see that having a lifelong impact on how they communicate uh, and especially like if somebody is being affected by the disease, like how they communicate it about with everyone else, if that's what they're hearing from their caretaker.
As we educate healthcare professionals, and frankly, this is for all of us, just anyone that anywhere, because we're all impacted in some way, is to understand that there's certain terms that are really judgmental, and we need to start to break those down. Just like we often say substance abuse, and that's very, there's a lot of judgment behind that. Calling someone an addict versus using person-centered language, it's a person with a mental health disorder. It is a person with addiction. It is a person with a substance use disorder, just like it's a person with obesity. So there's a lot of, I think, simple things that we can all do in our day to day life, but certainly healthcare professionals can understand just the language that they use. I mean, saying that everybody lies so you don't even ask the question is shocking and horrifying, but it's actually true. I can think of a couple of personal examples that I have with healthcare professionals when I've had some like minor dental surgery and they didn't offer me opioids. And I asked the question, why are you not offering me opioids? And they said, oh, most people are fine with Tylenol or ibuprofen. And so they don't even offer opioids, which it shows me it's a very educated professional. Didn't even talk about substance use disorder, addiction, or the challenges there, just automatically knows because they're educated on the topic.
I wonder about resistance to some of the education that you're talking about. I'm curious what are some tacks to help drive the point home or help that education be more better received.
So in behavioral health, we had two kind of gifts in a strange way in this arena. And one was the opioid epidemic, and the other one was the pandemic of COVID-19. And so I would say the opioid epidemic brought substance use disorder into middle America. Sad but true, but when this is impacting high school students that have sports injuries and the neighbor down the street or your cousin, it makes it a little more real, and it's something that we could talk about everywhere and any place. It just made it something that was top of mind. It was talked about on CNN. It's talked about by the government officials and the Surgeon General, and so that made it easier for us to talk about substance use disorder. The pandemic also made it a little bit more mainstream to talk about mental health, in the fact that all of us across the entire globe were impacted by this anxiety and depression, the impacted by the isolation and loneliness of the pandemic. And so it allowed us to have a different conversation. It allowed us to have a different conversation with remote work. How are your workers doing? Being so isolated, working remotely without having the daily contact. And so I think those two were gifts in that they elevated the conversation around behavioral health, and that opened the door for a lot of healthcare professionals as well as just people in the workplace to have these conversations. Granted, both of them are, you know, not something that we would have wished for, but they open the door to have a lot of conversations we wouldn't have had previously.
When we think about the way that that people with substance use disorder have been characterized over the past, let's call it the past 50 years, like there's really terrible terms that I think that have been heavily levied towards the Black community and others. And it does seem like the opioid epidemic, I think a lot of people like look at this, the way that the conversations are happening, and wish that we had paid attention and taken people with substance use disorder much seriously a long time ago, because these have been epidemics that have been happening for an extremely long time.
There absolutely is a cultural element to a lot of the stigma. And I will say that the opioid epidemic is very kind of become a white middle class problem. And so that made it more acceptable to talk about, unfortunately, but true. And so I think that it's important for us to continue to have the conversation around substance use disorder in general, because addiction doesn't discriminate. All of us know someone who has struggled with drugs or alcohol, whether it's your cousin, your brother, your friend from high school, the neighbor down the street. Everyone knows someone, because it doesn't discriminate. Same with mental health disorders. It doesn't discriminate. And there aren't cultures and groups of people that are not impacted. People are impacted across the board. There is more stigma in certain communities that prevent people from getting care. And there certainly is more stigma in substance use disorder around different drugs of choice, like you talked about. I think people who are willing to give their personal testimonies about their struggles, it breaks down a lot of barriers. And for that, like I mentioned, Betty Ford was one of the first to talk about her, first women to talk about her substance use disorder publicly. But you have people like Katie Couric really highlighted colon cancer after her husband passed. And so all of a sudden it's okay for all of us to talk about colonoscopies. Then you have someone like Michael Phelps and you have Simone Biles talking about their mental health struggles publicly. And I'm a massive fan of Simone Biles, and to watch her from a lot of different perspectives talk about her mental health struggles publicly, it also, I think, raised the conversation in the Black community to say, okay, this is somebody who's world famous, is the greatest gymnast of all time, and she's talking about this. So, maybe we can have a conversation in our community. It's really breaking down barriers. And if you ask me for a list of the ways we can break down stigma, talking about things publicly, and certainly having well-known people talk about it publicly, but even just regular old middle America folks talking about their struggles publicly, it breaks down those barriers, because people say, oh, they're just like me and I can have that struggle and they got help. So maybe I can get help too.
That's tremendous. And like, it is a significant help for people to come forward and share their stories. Would you say that there is like a difference in distribution, a difference in how certain illnesses are perceived? Like it seems like a lot of talk around depression and anxiety, but a lot of fear around, we were talking heavily about substance use disorder, bipolar disorder, and other. Like, why is there an imbalance in what's being destigmatized and what still remains a taboo?
A lot of that still seems to be the fact that people accept certain things as a disease and they don't accept other things as a disease. And they still see substance use disorder as sort of that moral failing when it is classified as a disease and has been classified that way for a long time. I actually was just in preparing for this conversation with you, polling a number of healthcare professionals that I know, and just recently talked to someone who said, yes, it's become, especially because of the pandemic, it's become acceptable to talk about our depression and anxiety, because those are now become acceptable mental health disorders because we've all been impacted, particularly during the pandemic. But it's not okay to talk about your bipolar disorder or schizophrenia in a public fashion. People are still really silent on those issues. Those are still very stigmatized. And a lot of it is because there's not enough education around it. And so that's something, the more and more education we can do on what these diseases are, what's the chemical imbalance in the brain, what's the nature of the disease, to help people understand there is treatment available. There's lots of great treatment available. Same thing with substance use disorder. Substance use disorder is a disease. It's not a moral failing, and there is life-saving treatment available for people. But frankly, I feel very positive about all the progress made around anxiety and depression, because that's at least one step in the right direction. But we do need to continue to have the conversation around bipolar, around schizophrenia, around substance use disorder, so that people are comfortable with that. An example that I talked to another healthcare marketer, and she was talking about ED, or they coined the name for erectile dysfunction, and it's become okay to talk about ED because the the advertisements are everywhere. Viagra, Cialis are sponsoring the NFL, and they're all over the place. And they've made it acceptable to talk about these diseases, but we still haven't talked enough about publicly about bipolar disorder or other things. So there is an opportunity for us to go along the same lines. I think about one of the most stigmatized condition is HIV/AIDS. And if you think about back in the day when Magic Johnson became very public about his condition, it was a little shocking and people were amazed. Well, now you have advertisements all over TV for the medications for people with HIV/AIDS. And it's amazing. I think it's amazing to see people, shiny, happy people who are taking these medications, and they're all over television, and it's making it so much more acceptable because it's visible. And the more you can have those, whether it's advertisements or people who are publicly talking about these conditions, and so that they're visible, so you can see, wow, they look just like me, and they're in an advertisement, or they're talking about their personal testimonial and they look just like me, then I understand more about the condition. So what we don't have is people out there talking about, not that many people, there are people talking about, I am someone with bipolar, or I'm a person with schizophrenia, or what have you. The more we can find that level of visibility and the opportunity to relate to those people, the more barriers we're breaking down.
I celebrate the progress that we've made in destigmatizing around anxiety and depression. I wonder if you see that maybe happening at the ground level, because like maybe a rising tide lifts all boats.
So a couple of the things that have happened, just like the example, erectile dysfunction now has a name, ED, to make it even more easy to talk about. But we can do similar things with bipolar, with other mental health conditions, where we have more visibility. So the media can be a source for good, and the media can be a source for evil. So the media historically, when you talk about mental health disorders, have really stereotyped people. They haven't really brought out people who are living a wonderful life and getting the care that they need for their conditions. So the media can do a lot in that respect, whether it's advertisements, in a movie, what have you. Even for me as a healthcare marketer and communications person, to be able to have more visibility for folks who are living their lives with these conditions is something that we can do. Really having those personal testimonials, I think, does a tremendous amount, whether it's actual patients or, like I said, in the media, where you just look at ED is a perfect example. It's shocking that we all can talk about that today, but because really advertising is what did it. Advertising normalized a conversation around it. So same thing with bipolar or other mental health disorders. We can have that conversation and bring visibility to it.
But I wonder about within institutions themselves, within caretaking institutions themselves. What are some of the ways that these challenges around stigmatization manifest for healthcare workers?
So my example I gave earlier is a perfect one, is the fact that people think, oh, people with substance use disorder all lie, so I'm not even going to ask the question. Same with obesity. I think there's a lot of data out there to show that primary care physicians spend less time with people with obesity. There's data out there showing that even though people with obesity tend to have a lot of comorbidities, and so they might need more time with their primary care professionals. And so some of this goes back to straight education of these healthcare providers, whether it's anyone working in the healthcare system, but healthcare providers in particular are ones that need to have more education on what's available. I think when you think about these days, there's such a conversation, and this can turn out hopefully in a positive way, but there's such a conversation around Ozempic, Wegovy, the whole all the medication available for treating obesity. And this can really, I think, turn the tide around obesity. I mean, Ozempic's all over People magazine. It's everywhere these days, but it is a medication to treat obesity. And so we do need to be able to look at it as a disease. There's medication to treatment. It's not a moral failing.
What's the outreach? What's the path that we get to make sure that these people know that there's some sort of way to have those kinds of conversations or access those kinds of learnings that they're just they don't want public and they want it to be completely confidential?
I think the labels is a big important kind of area that all of us can help with, especially I think leading the way can be healthcare marketers. And that's really using the person centered language so that there is less stigma around those labels. Because when you call someone an addict versus a person with addiction, you call someone a schizophrenic versus a person with schizophrenia, you call someone obese versus a person with obesity, it really takes a lot of that shame and the judgment out of that label, if you will. It's the same as if you have a person with high blood pressure, you don't call them high blood pressure. It's a person with high blood pressure because it's their condition. They are not their condition. They're not a bad person. They're a person with a healthcare condition. And again, there's life-saving care available for these folks. And that's where it's so important, I think, just even the language that we're using so that we're not so concerned about these labels because they can be so stigmatizing. I mean, substance abuse is just one. When you think about it, it's just so stigmatizing that you're abusing substances, and it implies that you're doing it essentially because of your moral failing.
You use language around like how you the context you provide around things, the way that you say things has an impact on whether people are willing to stand up and speak up, right?
Yeah, absolutely, absolutely. It does make a difference, and I think people like writers, marketers, we can lead the way on what language we're using in these situations because it's separating the person from their healthcare condition. They are not their healthcare condition, and that we can really remove a lot of that judgment from it. I think I think frankly a lot of the things that you're doing with Wobot are along the same lines. It's kind of anonymizing it to an extent and letting people get care for their mental health issue without having to sit here face to face with somebody so that they can kind of take that first step to get the care that they need, and maybe not anonymously but kind of anonymously. It feels much more like that, and that's where virtual care and telehealth has done so much for us in that same perspective, because you can get the care you need from your home for mental health issues, for substance use disorder, for a number of different medical challenges. You don't have to physically go to an office and be seen face to face with the person. You can get a lot of that care today from the privacy of your own home. Again, it's a strange little gift we got from the pandemic, is that telehealth was pushed into the forefront of just normal life. It's a normal thing to be able to get your care through your computer or through your phone these days, through an app.
That does provide some good additional perspective too, because you began with the conversation on the language around it, but then when you bring up these other platforms such as ours, such as digital health platforms, telehealth, etc., then it just shows where the doors are more open to have conversations, but on your own terms.
Yeah, it's really meeting the individual with where they're at. So sometimes an individual is ready to take a baby step. Sometimes they're ready to take the next step. Sometimes they're ready to take the next step. And so how do we meet them where they're at? If they're only willing to pick up their phone and interact with an app, that's still a first step in the right direction. If they're willing to meet their healthcare provider virtually on a telehealth platform, again, it's another step in the right direction. What we need to do is make this life-saving care available to individuals however they're willing to receive it. And really, I think platforms, digital health platforms like yours, like Wobot, like other telehealth platforms, I think it's brought us into a new environment. And so those kind of opportunities are really, I feel like, leapfrogging where we were even 5 years ago, just because of the pandemic.
Just curious about your overall advice for people who want to address stigma, like just as a healthcare professional or digital leader, what are some other thoughts that you have for people that are interested in addressing this issue?
I think all of us can start to impact stigma, even if we're not a healthcare provider. There's so much each of us can do. Part of it is having conversations like this, bringing it out of the shadows. If we open the door to a conversation, 9 times out of 10, that's the biggest first step we can make. The other one is really, it's around the person-centered language. I think that's another thing all of us can do, is to stop using this real stigmatizing, judgmental language, because there's so much of it out there. It's not hard to flip things around and make it about the person, that they have a healthcare condition versus that they are their healthcare condition. I applaud everyone who can talk about these things publicly, and particularly those of us who work in healthcare, who are a lot of your listeners. We can be the ones on the forefront of that, having these conversations. And that's where, Chris, I really applaud you. I think the other day I watched a podcast that you did with, with Sandra Brown, and you did a great definition of empathy. So I'm gonna speak it back to you. What you said was your definition of empathy was making the effort to put yourself in another person's shoes. And I think that's something else that we can all do, is have empathy for different individuals that have some of these different conditions. If we put ourselves in their shoes, how can we have a better understanding of the conditions that they're living with?
Melissa, thank you. Thanks for reminding me of that. But yeah, empathy. When she asked that question, I really wanted to address the idea that people might call themselves empaths and then make a whole bunch of assumptions about what other people might or should be thinking based on their predisposed notions. So I just wanted to address any, get rid of any thoughts around the telepathy or anything like that involved, and just say, at least make the effort to put yourself in someone else's shoes.
And half the battle is making the effort. And so I think that's half the battle. If we can, as healthcare professionals, make the effort, that's a step in the right direction.
On that note, like we're thinking about these global perspectives, and we've addressed a large number of challenges today. We've talked about some ways to overcome them, but we're going to give you a superpower right now. We're going to give you a magic wand. If there's any one thing that you could change about our healthcare system, what would that be and why?
What I think is really, it's around the education for our healthcare professionals. When you think about it, and I would say everyone from your local pharmacist all the way through the reception at your doctor's office and all of the providers in between, to have more education for them around these different conditions, because oftentimes they're not asking the questions. And if they ask the questions, a lot of people would actually raise their hand and say, yes, I'm struggling. And so that's the part where, with your local pharmacist, I think it's the most used healthcare benefit that people have. Well, maybe the local pharmacist needs to ask those questions. Maybe it's even the receptionist can pick up on something. It's their healthcare provider. If they're asking the questions, oftentimes people are going to raise their hand and say, yes, I need the help. And people, I think today, oftentimes are not even asked those questions, so they're not receiving the life-saving care that they need.
That's a major point to bring up, and it differs from a lot of the answers that I've heard in the past, because a lot of the answers might focus on the incentive structure and economic structure, financial structure, which is obviously extremely important, but there's something to be said for the culture and just the knowledge of each individual involved in care, whether it be under a fee-for-service or value-based perspective. Without that education, without understanding when problems are surfacing and having the willingness to speak up about them, then we still end up in the same place.
That breaks down the stigma. When you're willing to ask the question and have the conversation, it's breaking down the stigma right there. It's normalizing things. It's bringing it out into the open and saying it's okay for us to have a conversation, because I'm going to take your blood pressure every single time you go to the doctor. Well, there's other questions I can also ask you to possibly see if you need some other care. I just applaud what you're doing, Chris, and other digital health providers what they're doing, a lot of this cutting edge, very innovative work. We're allowing people to get care in different ways. We could talk for hours and hours and hours about how much people have to pay out of pocket for behavioral health. If we can break down the stigma by asking questions and bringing those conversations out into the light, it's going to make a difference for an awful lot of people.
Well, again, Melissa, huge, gigantic thank you for hopping on this and have a conversation. For the folks out there who might want to follow and see what you're doing or have deeper conversations, et cetera, what's a good way for people to keep in touch, Melissa?
I'd say connect with me on LinkedIn. I love LinkedIn. It's a great platform. Connect with me. I think that's an opportunity to share work I've done with Shushmid, work I've done with other organizations. I think it's just a great resource for people to get more information about what we're doing with behavioral health and how we're breaking down the stigma.
As for the rest of it, having this conversation, Melissa referenced earlier the massive trauma around the opioid crisis and then around COVID-19. That just reminded me of a really powerful conversation we had with the manager of the I think the neuroscience department at Henry Ford Health System, Dr. Robert Matheny. We had a conversation with him on organizational trauma and healing. I think that would be a really good follow-up to this conversation if you're interested in exploring more about what you might be able to do as an individual to address areas around stigma and mental health within your organizations. With that, thank you very much, everybody, and we will see you next time.